This is going to be a really fun portion of the day now. We're going to have a series of what I hope, I'm sure, they will be very lively, very informative, and hopefully very dynamic panels. And again, we took your feedback. We've done this a few times in the past, and the feedback we got is you guys all like it. Gets you thinking, and most importantly, gives you an opportunity to interact with really a world-class panel here. And we do have a world-class panel. At the far side, the sleep pioneer himself.
Just anyone's wondering.
Yeah, just in case it didn't. Dr. Tony Mastry is our local and beyond sleep expert. A physician who is going to clearly have some very good insight into a risk factor and important management. And then, of course, my good friend, dear friend and partner, Dr. Neil Scott, who's done this multiple times and always gets called back. And Dr. Scott, who's been working here at El Camino pretty much almost as long as I have, has taken a special interest in nutrition, and he does a tremendous job sharing with his patients the value and the importance at a very scientific level. And he also directs the Cardiopulmonary Wellness Center that we'll hear more about later. So you see, we have a little bit of sleep, nutrition, activity. We have a theme here, and this is a theme that Dr. Friedlander already alluded to in these very interesting blue zones, these areas where people tend to live a little longer, and they tend to live very healthy lives. And we have a great physician, Dr. Jane Lombard, who's going to run this panel. And Dr. Lombard, she doesn't only just talk the talk, she walks the walk. I don't know anyone who exercises more than you do as a physician.
I'm addicted.
She's addicted. She's already swum a couple of, how much did you swim this morning?
Couple of miles.
Couple of miles. Oh,
I missed you, Neil.
I'm getting tired of just thinking about that. No, but seriously, and Jane runs the women's health program here at the hospital, and take it away, Jane. Thank you.
Okay, great. Well, welcome everybody, and thank you for coming today. I promise you this will be not just informative, but it'll be entertaining. So thank you, Dr. Friedlander, for introducing the idea of the blue zones. How many people here has heard of the blue zones? Okay, yeah, maybe a third or half of them. How many people have watched the documentary? Not too many. Okay, how many people have been to the blue zones? 1, 2. I've been to 4 out of the 5. I haven't gone to Okinawa yet. So first slide. Okay, so the blue zones, I'm going to use this sort of as a fulcrum to discuss all the variables on how you can improve your lifestyle. So lifestyle is the stuff that you can do, and not our drugs, not our procedures, etc. Lifestyle, lifespan, which is how long you live. But more importantly, I want to focus on health span. Like what the first slide, the 85-year-old, who wants to live like that? Who wants to live like that in a wheelchair and then, have the family take care of them? No, you want to be independent and be, doing everything you love and being with the people you love. So the Blue Zone started, a long time ago. I think it was in the 90s when Dan Butner, who's like a crazy person, who's an endurance mountain cyclist. He rode 15,000 miles from Antarctica to the Arctic or something like that. But anyway, he went to all these places and was really curious. Like, these are the 5 spots in the world where people not only live to be 100, the highest concentration of centurions, but these people are really fit. They're still working, not just, doing accounting or something. There's a cowboy in Costa Rica, there's, it's a fisherman, etc. They're still working, they're happy. So really start, why is it that these people live longer and are, happy and very productive? And so you look at it and it's like, okay, well, they're kind of all in the equator. And I think if I lived in Sardinia on an island or Greece on an island, I'd be happy too. But Loma Linda is urban. Loma Linda is urban. Does anybody know what population lives in Loma Linda? Seventh-day Adventists. There you go. And the Seventh-day Adventists have a very sort of, a big part of their religion or beliefs or their philosophy is lifestyle. They don't drink, they don't smoke, they don't drink coffee. I don't know how anybody can do that. But they go to church, they believe in community service, all that kind of stuff. So Loma Linda is urban, and if you look at their lifespan and compared to Redlands, which is also in San Bernardino County, but right across the freeway, there's like a 20-year difference, 20 plus 30-year difference in lifespan. So that is very, so it's urban, and there's definitely difference between the lifestyles. So next slide. Oh, sorry, I forgot. Thank you. I need some cognitive improvement. So Dr. Freelander introduced the idea of the blue zones and the pillars, and I'm trying to put them all in buckets. There are 9 things, but the main buckets are, so she already talked about move naturally, and Neil is going to talk about eat wisely. And when they talk about the right outlook, it's really about how you look at life. And I think the first thing they said is, you look at all these population, they don't spend 80 hours a day at work. Or a week, 80 hours a week. We don't have 80 hours a day, sorry. I wish I did. But, they value personal time with family. So it's like, they call it downshifting. And that will go into the whole sleep thing. Americans are sleep deprived. How many hours of sleep do you need? I think it varies highly. Some people get 4, some people need 10. So it's all over the place, but you should get what your body needs. And the other thing about the outlook is purpose. People need to get a reason to get up at 5 o'clock or 8 o'clock or whatever o'clock it is. But you need to have a reason to get up. A reason to get up and look forward to your day. Whatever it is, whether you're teaching, you're taking care of patients, art, etc. And then a really important thing, which I'm going to focus on in the next 3 minutes, is connectivity. And that is, the 3 things that they put in that bucket is they value their loved ones, friends and family. And I noticed when my kids were little, friends were the most important thing. When my parents got older, friends are the most important things. But somehow, in our busy lives between 30 and 60, we forget that, and we just work. They also, these communities, they also have a sense of belonging. They belong to a community, and then also picking the right community. So I wanted to talk about belonging, because loneliness, if you look at the U.S. statistics, 1 out of 4 people in the United States admits they're very lonely. And half the population say they're somewhat lonely or very lonely. And I think it's exacerbated since we had social media. Kids don't talk to each other anymore. They text. They don't congregate. They go on social media, which is, very artificial. And so this is a huge problem. And how can we fix that? Well, in the UK, what they've done is they started the government, because they have national health. The government's very interested in preventing people from, getting sick and going to the hospital. They've created sort of these community hubs so people can get together, meet each other, just chat, whatever. But the data shows if you're lonely, you increase your risk of having a heart attack or any sort of cardiovascular event 15 to 20%. Okay, so you can say loneliness is almost a new, like cigarette smoking. Finding the right tribe. How do you know, who are your people? Who are your people? And I remember this from Sally Jewell, who was one of the Secretaries of Interiors under Mr. Obama. She gave a talk for my daughter's graduation, university graduation, and she said, she was the ex-CEO of REI, great company, and she said, volunteer, because you wouldn't volunteer at something you don't like or you don't believe in. So if you volunteer, you're going to find your peeps, right? And then that's your community. And it's also your passion. So yeah, so my swim team, It's my, sort of my community. Then I have a bike team, and that's my community. And I have an art team, and then I have all these people I work with. So I think every one of us need to remember that. Yes, exercise is important, diet is important, but there are all these other things that can make you live longer and be happier. So that's what I want everybody to focus on, is not just lifespan, but health span. And I'm going to move on, and Dr. Masri is going to talk about downshifting and sleep. You don't have these slides.
I don't have slides, so can you hear me? Okay. Yeah, first I want to thank El Camino for putting this event together and giving me an opportunity to talk about sleep, because I love doing that. And so we talked, someone asked a question earlier about how much sleep we need. And so the way I think about sleep is sort of from two perspectives. One is the quantity, how much we are sleeping, but more importantly, how much we're giving ourselves a chance to sleep. So there's one part you can do, and then one part you can seek help with. The first part is giving yourself an opportunity to sleep. And that doesn't mean just time in bed, like the 6 hours or 7 hours, and we'll talk about how much that is in a second. It's just also part of the wind down. We're not laptops. We're not just meant to have, you press a button and then you're asleep like 5 minutes later or 2 minutes later. We are meant to have a natural wind down that separates us from the busy day, the hectic day where we're going from one task to the other, to allow our body to sleep, because sleep is a natural process. It's a passive process. It's more about letting go and letting your body and mind refresh, get into these states of consciousness that are from light sleep to deep sleep, REM sleep, which are really important for us to refresh emotionally, physically, mentally. Sleep is a rinse cycle of the brain. So a lot of neurotoxins, we know this from now studies, that a lot of neurotoxins get cleared, not just from sleep in general, but certain parts of sleep, which is deep sleep. So wind down is really important. So let's talk about the common question here, probably came up already, is how much we should sleep. And I'm going to shift the thinking here a little bit, because oftentimes we sort of get in the way of our sleep. We, as in our lifestyle and our commitments and the decisions we make. So if you are waking up with an alarm every day, odds are you're not getting enough sleep, right? Because you're artificially waking yourself up. If you are sleeping in on the weekend for like an hour or two, you're not getting enough sleep, because your body is almost like jet lagged. You get an extra hour in the morning, on the weekend, and sleep debt is kind of like money debt. You can't just like be sleep deprived for 5 hours and sleep 2 hours on the weekend and say I'm caught up. You actually have to catch up the whole time. And the other interesting thing we found out is there are signs that your perception when you're sleepy, when you're tired, your perception is off, kind of like when someone is a little intoxicated. You think you're probably more alert than you actually are, whether you're driving or whether you're paying attention at work. If you've been, of interesting studies done on executives, and executive function is really important. A lot of business consulting management companies like McKinsey have looked at this to see if you are up at 18 hours straight and you're looking at a spreadsheet or working on a presentation, you have the attention and the cognitive performance of someone who has an illegal level of alcohol in their body. So your perception, so don't count on that. So you need to kind of hold yourself accountable first, and don't say, well, I can get by, especially when you're doing the work day in and day out. You can go through it and without being sort of fully present. So the first part is giving yourself enough sleep. It's usually, I would say, 7 hours. If you're sleeping less than 7 hours, there's a 95% chance you're probably not getting enough sleep. 95% chance, because there are outliers. There's some people who need less sleep, but they're a lot less common. They're not every other patient I see, because I hear that every day. So assume that you need close to 7, maybe even more than 7. And the reason I say 7, it's like you don't want to set an 8-hour goal, which sometimes can be really frustrating to get there. And some of us don't need full 8 hours. Some of us might need 7.5. So if the data also show from a cardiovascular standpoint that you are more at risk for cardiovascular disease if you're sleeping less than 7 hours, and your body needs that. So that's the quantity. I'm sure I'm okay on time.
You're good.
Yeah.
There.
So quality, which is another aspect, very important. That's where we spend a lot of time. So what gets in the way of quantity, other than you giving yourself an opportunity to sleep, is insomnia. And insomnia is very common. I can mention lots of numbers, but at least 20+% of Americans have experienced insomnia. about 40% of Americans take some kind of sleep aid or have taken a sleep aid, whether it's over the counter. At some point back in the day when Ambien was the main hypnotic, it was the single most prescribed medication. So it's a very common. When we look at epidemiology data, when we track our population in the US, we can really see a clear trend line of when we started sleeping less was the obesity epidemic taken off. I'm sure there are a lot of factors to obesity, but sleep is a big one. So if you're eating, even if you're eating healthy, not just the amount of calories, which there's a lot more to that, as you know, even if you're eating the type of food, very healthy, if you're not getting enough sleep, your metabolism is not going to be healthy. So sleep is very important for that aspect. So insomnia is a real thing, and once it becomes, if you are really struggling to fall asleep, if you start dreading going to bed, if you give yourself enough time and chance to fall asleep or even wind down and you're still having trouble, you probably have insomnia and you should seek care. And the treatment for insomnia, the gold standard is cognitive behavioral therapy, which is one of the areas I specialize in, but also medication. And sometimes medications, hypnotics have gotten a bad reputation, but like everything else we do as physicians, we're not prescribing something just to prescribe it, right? We're assessing risk versus benefits. And sometimes medications is needed because the benefit of getting an extra hour of sleep sometimes outweighs whatever side effects we might be concerned about. So it's important for you to take care of your insomnia and get the 7 hours plus, whether it's giving yourself an opportunity, whether it's doing cognitive behavioral therapy, or even taking medication. Now, the quality, which is the next important sort of component of sleep, is you need to make sure when you get enough sleep, you're waking up refreshed. Your sleep is not as interrupted. So the most common thing we see, especially in a cardiologist's office, actually 1 in 3, the data shows 1 in 3 in Dr. Lombard's office waiting room. Hopefully it's not a long waiting room. We all have that. We know what Mike's doing. But people in the waiting, people just come into a cardiologist without asking them any single question. 1 in 3 of them have sleep apnea. Mm-hmm. And sleep apnea is very common, much more common than you think. And there's different types of sleep apnea. There's central apnea, there's obstructive apnea. You can have mild apnea and be tired. You can have severe apnea and not be aware of it. Snoring is a common symptom, but it's not always there. Most of us who've been with partners a long time, you might kind of tune that out. It's good for your relationship. But you might forget that your partner snores, but it doesn't mean they don't, or they're not having good quality sleep. So in sleep apnea, there are really good effective treatments. I know CPAP, sometimes you think of it as this big mask, but it's gotten a lot better. It's very quiet. And we work with our patients to make sure they're diagnosed correctly here at the sleep program, and they are able to, whether it's the CPAP or oral appliance, sometimes there are surgical options, they are doing better over a long-term period, not just like, here's a diagnosis and you're kind of stuck with this and you're trying to struggle to figure out how that works. So those are sort of the most common areas I focus on. There are other things that are less common, things like parasomnia, which make my job a little interesting, people who sleepwalk, who do REM sleep behavior disorder, which comes up in Parkinson's patients, people act out their dreams. Also, restless legs is something we deal with. Mm-hmm. So whatever don't take your sleep for granted. Don't say, well, I've slept an extra hour on the weekend, so I'm all good. Or I have my trackers. Wearables are helpful, but they're not necessary. They're helpful in terms of holding us a little bit accountable to get enough sleep, to realize, for example, what an extra 2 glasses of alcohol do for our sleep, or what exercise does for our sleep. But ultimately, we have to kind of see where we are to begin with and work to improve that one step at a time.
Great. Well, thank you.
You're welcome.
Okay. Next is eating wisely. Dr. Scott.
Thanks. And I'd just like to say it's a pleasure to be here again. And what we're going to talk about is how what you put in your mouth makes a big difference in how long you live. And if we go back to one of the slides that Dr. Friedlander showed in her excellent talk, she showed a hunter-gatherer who ran down a gazelle, and killed it, usually with a rock or a stick. And then chances are they'd have to drag it back to their encampment and using sharp rocks or sticks, cut it up, and then cook it and eat it. And if we step back and think about what we are, we're human beings. And we're known as modern humans. And people like us modern humans have been on this planet somewhere around 100,000 to 200,000 years. There were other humans that were evolving at the same time that were around, and they're no longer with us, mainly because modern humans probably wiped them out, or interbred with them, but probably wiped them out. And that's mainly because modern humans were best adapted to survive and thrive in that environment. And that environment was the Stone Age. Since the Stone Age, there has been no further evolutionary change other than maybe in a few subpopulations the ability to drink milk after weaning. There's been no change in modern humans. So we have the same bodies that cavemen and cavewomen had. And the environment that they thrived in was a caveman environment. So in order to eat, we had to expend a lot of energy. We had to go out there, run down an animal, or forage for food every single day. And the amount of energy that was spent was huge. And what we ate then was very different than what we're eating now. What we ate then were things that were very high in fiber, lots of plants, vegetables essentially, vegetables and fruits, and very low in concentrated sugars, very low in salt. So also when she showed the slide of what we look at when we go shopping, it's all totally different than what we were evolved to eat. And so it's clearly been shown in studies that have been done since the 1960s that there's a diet that clearly shows the benefits and has been proven to show the benefits of extending life and extending health, freedom from cardiovascular disease, freedom from many types of cancers. So, can I have the next slide, please?
Sure.
And that diet has been called the Mediterranean diet, mainly because investigators looked at components of diets around the world, and it was clearly shown that the peasants after World War II, who were really poor in the Mediterranean area, were mainly farmers and fishermen. They did not have access to cattle or other mammals, and they had to survive on what they either grew from the land or caught from the sea. And the components of that diet clearly have been shown to extend life. They wanted to call it the peasant diet, but since a number of countries were slowly modernizing after World War II, they said, we don't want to be associated with peasants. So he said, okay, we'll call it the Mediterranean diet. And that diet is, can I have the next slide?
Oh, this is the next slide.
The next one.
Oh, this one, okay.
Very high. These are two pyramids. So on the left is the Mediterranean diet. On the right is the Western diet. So up at the top are the things that you eat less, and at the bottom are the things that you eat frequently. So a Mediterranean diet, you're eating lots of fruits, vegetables, nuts, whole grains, cereals, fish, and very rarely, usually it's once a week, and even then in small portions, red meat, meat from mammals, beef, pork, lamb, goat. Whereas the Western diet is totally the opposite. And it's clearly been shown that the more of the Western diet you eat, the shorter your lifespan when you compare populations. So we need to eat right. We need to eat what we were evolved to eat, because we were evolved to be eating high fiber foods that are not processed. We were evolved to exercise a lot, and that's what our body responds to. Okay?
Okay, so I'm going to go back. And so you say, okay, so lifestyle, if you change your lifestyle, is this going to make any difference? Is there a study that has been shown that if you change lifestyle, it would change your lifespan and your health span? How many people know about the Finnish experiment? One. How many people know where Karelia is? Nobody. Did you know this was a geography class? So Karelia is this section here that actually is, politically, what's the word I want? Now it's, because conflictual, because the Russians occupied Karelia, part of Finland, for 100 years. And this is a section now where Finland is like, right next door to Russia. And they found out in the 1960s, the average lifespan of Finns in Karelia was 55, just like the Russians. Russians have a terrible lifespan. And they're not happy either. So the government decided, Finland is, they're not really Scandinavian, but they bucketed into that. So they're, Scandinavian or Nordic socialists. The government decided, we got to do something about that. So they did a pilot study in Karelia with intervention. They didn't have more doctors, they didn't have more hospitals, but it was public health. And so they decided, okay, we're going to teach people not to smoke. We're going to teach people not to drink. Alcoholism was rampant. And actually, if you go to Finland right now, they give quotas like how much alcohol you could buy, but they all cheat and they take the ferry to Estonia and buy more. You can't do that in the United States because it's called, they'll say that's a limitation of free trade. And they also started educating elementary schools what they should eat. And of course, the kids learn better and they go home and teach their parents, right? And also they said exercise. So it was so successful, they expanded it in the entire country in 1977. And when I went to Helsinki 10 years ago, you go to Helsinki and there's one lane for cars, one lane for buses, one lane for bicycles, and one lane for pedestrians. And everywhere there are big posters don't smoke and move and blah, blah, blah. And now, as National Geographic, Finland has the longest lifespan in Europe. And, they beat Denmark as having the happiest population. But if you talk to the Finns, they say, we're really not that happy. We're just very contented. So it all depends on, it's like, it all depends on your definition. But I think that's what we strive for. We want to have a life that's fulfilling, that's long, and productive. And I'm out of time. No, I have one more minute, but we can go ahead and start questions. Back there. So do we have a question from the online people?
Yes, we do. Sleep doctor. Can you sleep too much is one question. And the other question was related to naps and sort of the role of naps in the amount of time that you sleep, and does that count, and is it helpful?
Yeah. Yeah, I'll repeat the question. The question was, can you sleep too much and the role of naps? And before I get into that, I just want to comments on Neil's point about our evolutionary body, that our body's been around for 100,000 years the way it is, and there's not a lot of changes. That obviously the same thing applies to sleep. So I sometimes tell my patients, your bedroom should be the same thing that the bedroom would have looked 1,000, 2,000, 3,000 years ago, obviously. So not as much electronics, not as much light that's not supposed to be there organically. Something to keep in mind. It's like the best sleep is organic sleep, kind of like food. So back to the question about, so yes, sleeping too much can be bad. Not that intentionally you're sleeping too much. It's kind of we call it like a U-shaped situation. If you're sleeping too little, obviously you're not giving your body enough time to sleep. But if you're sleeping too much, usually it's secondary to a medical problem. It's more of a sign than it is, like if you need to, sometimes you need 9 hours, sometimes you need 9.5 hours. It's also, when we say 8 hours is an average, some people need to sleep 9 hours. I occasionally get patients who say they don't have trouble falling asleep, they wake up refreshed, but only if they get 9 hours. That's basically what you need. Maybe it's not as lucky as some other people, but if you're sleeping definitely in the close to 10 hours range, it could be a sign of depression, it could be a sign of a neurodegenerative disease, someone's having, typically you already have symptoms of Parkinson and other things, you can have cardiovascular disease. It's usually not the earliest sign. Typically depression is one of the things we start looking at. Naps. So naps are helpful. You don't want to be, if you can't get through the afternoon without taking a nap, even though you slept enough during the night, that could be a sign of poor quality of sleep. If you're not getting enough sleep and that's your opportunity to occasionally catch up, I think a 20-minute nap before 2 p.m. won't interrupt your ability to fall asleep at night. Usually is okay. We know from the airline industry in terms of performance, if you're really stuck and you can't sleep more than 5-6 hours, yes, a nap can be restorative more than 20 minutes. You can do 90 minutes or 2 hours.
Okay, we can take a question from the floor.
Yes, I have two questions for Dr. Masra. Do women have a greater propensity for insomnia than men? And could you also describe some of the distinctions and potential overlaps between insomnia and sleep apnea?
Yeah, it's a good question. Yes, some data shows some of the prevalence in women.
Can
is
you repeat the question?
Yeah, okay. So the question was, do women get more insomnia than men? The other question is the overlap between apnea and insomnia. So do women get more? We initially, to some extent, yes, you can say yes. In terms of insomnia being symptoms that women report these symptoms more often than men. So our initial perception, yes, it happens more in women than men. But if we really look carefully, insomnia can affect men just as much. Also, women, when they're going through menopause, insomnia is the second most common complaint after hot flashes. So that's kind of skews the data a little bit. So apnea and insomnia, unfortunately, in medicine, as we all know, you can have more than one problem, right? So sometimes you have more than one problem in the same area. So it becomes its own difficulty having insomnia and apnea, because apnea is you're slowing down or stopping breathing at least 5 times an hour. When you're severe, it's 20, 30 times an hour. So there is what we call like a drive and sympathetic drive. It's kind of like a bit of a flight and fright response. So you're in this hypervigilant state, which is what insomnia is. Insomnia at its core is not just takes you longer to fall asleep. It's this hypervigilance, amped up state that sometimes can be similar to anxiety. So when your body is constantly trying to breathe, that can drive up that hypervigilance state and actually makes the insomnia worse. Also, insomnia can make it sometimes hard for people to wear CPAP and get treatment.
I think we'll take another question from the online audience.
Dr. Scott, this is for you. Vegan or Mediterranean diet, which is better and why?
It's a very good question. Mediterranean diet has been studied since the 1960s in detail with thousands of very good studies looking at millions of patients. So there are a lot of data on Mediterranean diet and its benefits. Vegan diet is relatively new. However, the few studies that have been done show that there are real advantages to a vegan diet. However, one also has to worry somewhat about vitamin deficiencies, so you have to take supplemental vitamins. But the data are not nearly as extensive about vegan diet as they are with a Mediterranean diet.
Okay, question on the gentleman in the blue shirt, and then Ethan, you.
How can I train myself to have more deep sleep?
So
Dr.
the
Masri.
question is, how can I train myself to have more deep sleep? So deep sleep is typically in our world we call slow wave sleep, which is about 25% of the night. It's a good question. Basically, living a healthy lifestyle can contribute. There is some data on a high fiber diet that can actually improve your deep sleep. Avoiding things, alcohol can mess up your deep sleep. So kind of like if you're eating well and exercising, that will lead typically to more deep sleep. Also, if you have apnea, obviously that can interrupt your deep sleep. So treating that is really important.
I think it's really important to think that none of these exist in isolation. Okay, so if people sit on a computer screen all day with that blue light and don't move, they're not going to have very good sleep. So it's like, you have to take the whole package and have a good lifestyle. And I think we'll take one from online, and then we'll take the question over there.
So another one for sleep doctor. The difference between snoring and sleep apnea and weight reduction, and does that help?
Yeah, so was the weight reduction question. Definitely it helps. Assuming, that's we're talking about unhealthy weight. That could never be bad for you. So anyway, it does reduce apnea. So the best data we have is if you lose usually that 10%, that's the worst part of your extra body weight, then you can reduce your apnea by 20, 30%. If you lose 20%, which is oftentimes a really healthy goal, you can cut your apnea by at least half. Having said that, you can be very fit and still have sleep apnea, so I don't want to confuse the two. So snoring and apnea is a bit on the spectrum. Yes, you could theoretically have some snoring and not have clinically significant apnea, because apnea is on the spectrum. It's kind of like you can have an extra pound of weight, or your blood pressure occasionally can be up, and that's not necessarily clinically concerning. But typically, I would think about snoring as a sign of apnea until proven otherwise.
Okay, question over there.
My question is for the blue zone expert and also the sleep expert. So let me go with the blue zone expert. What is the one thing most common among the 5 blue zones which they do, or there are more common? And the part B of this question is that why it is called blue zone? Why it is blue, not red, any other color?
Okay, so I'm not a blue zone expert, but I can I can answer both those questions. It's called a blue zone because when Dan Butner first found all these, he actually traveled there, interviewed all these people and everything, and it's really interesting on the documentary because it's also exotic. I just like watching movies when they go to different places. It's called the blue zone because they use blue markers to mark the places on the map. And he actually got a grant from National Geographic. So he's not only a crazy biker, but he's also an explorer. So he'll go to all these different places. And so the common things are, it's not one thing that they found. It's the whole package. You have these people, they get up, they have a job where there's taking care of their family, they care for each other. None of these societies have nursing homes for their elderly. And I would say that when I watched the movie, their culture is very different. They have sort of a value culture. Everybody has value. It doesn't matter if you're old, you're young, everybody's important in that community. And I think in the United States, we have very much an honor culture where it is what you do. You go to a party and everybody says, what do you do? Next thing is, where do you live? How big is your house? And then they never ask you how much money you make, but it's kind of like that, right? It's your status. And in those cultures, they're very inclusive. And they have family and friends, and so it's a whole package. So you need all of those. But I think if you have that kind of culture, of course you're going to move more. And they, like Dr. Freeland said, they don't go to gyms. They go to church and they stand up and sing. They go dancing. They go, they walk around with their dog and their grandkids or their kids. So it's a whole package. And he's doing a study now trying to convert communities to do that. And just like in Finland, we can't do it alone. Our corporate culture makes it that you have to drive, you have to move. And there are places, there are food deserts, where you can't get anything to eat besides Cheetos. So we have to change that. And I think actually this is a great neighborhood to change because we're Mountain View, Sunnyvale. It's very progressive, and everybody's smart, and everybody wants to live longer. Nobody wants to go to a nursing home. Okay, another question from the online people.
Thank you, Doctor.
Did you have a sleep portion?
Yeah, that is what it. So my sleep question to the sleep pioneer is that you told that we should have uninterrupted sleep and then we should automatically wake up. That should be the normal way without the alarm. But here in the audience we have most of the seniors. I think most of them to have to wake up in the night. So they always have interrupted sleep. So how many hours really you gave a discount to these all seniors who are sitting here in this class? And second part of this sleep thing is very important. I have more question, but I will talk about if we do meditation, can we reduce the number of sleep hours? So I will only talk about 2.
No, on the meditation. It's great to do meditation, and it's helpful. We don't have a lot of time left. But quickly, I just want to clarify, and I'm glad you brought this up. What I meant by uninterrupted, I meant like what we do to interrupt our sleep. Like we create, but it's not abnormal to wake up in the middle of the night. Definitely not once. If you wake up once, it's perfectly normal. Again, back before electricity, and we used to sleep more often into stretch, especially after age of 40. But just because we age doesn't mean our sleep has to be bad. Our sleep actually does not decline that much as we used to think. So if you're waking up 5-6 times in the middle of the night, there's a problem. Just not because you're old. When we get old, there's more medical problems get in the way. It doesn't mean our sleep is naturally just going to become poor.
Okay, is there another question from the audience? I mean, from the online virtual? Yeah, there's a lot of them out there.
A fair number of questions about sleep aids. A lot of sleep questions here.
Oh, wow. Tony, you're popular.
Melatonin. What do you think about melatonin and other sleep aids?
Yeah, I get this question quite a bit, as you'd imagine. So sleep aids in general, it depends on why are you taking them. It's a really important question is why you're taking the sleep aid. If you're waking up multiple times in the middle of the night and you take a sleep aid, that's probably not, there's something else could be waking you up in the middle of the night, like sleep apnea, for example. Melatonin is okay. From studies that we've done, if you truly have primary insomnia or what we call clinically insomnia, melatonin is not going to be as helpful. Melatonin is a better tool for setting your circadian rhythm and using a much lower dose, oftentimes like sometimes 4 to 5 hours before intended bedtime to kind of shift your clock if you're really a night person and you really have to wake up early for the job. Is it benign? For the most part it is. In kids, I wouldn't recommend it without really talking to your doctor. If it's helping you get an extra 30 minutes to 40 minutes, great. I don't have a problem with it. It depends. Melatonin can cause vivid dreams. But it's important to ask the question of why you're taking the supplements. I'm not a fan of diphenhydramine, which is the over-the-counter Benadryl. This has a long half-life. It can affect your thinking. It's an anticholinergic. So be careful with some of the antihistamine over-the-counter. They're not as benign as you think.
There was a question on the floor over there, the gentleman with the hat.
This is a question for Dr. Scott. Regarding diets and Mediterranean and things like that, has there been any evidence that having a healthy diet will reduce the amount of cholesterol deposits in your blood vessels?
It's clearly been shown that going on a Mediterranean diet will reduce or can reduce your serum cholesterol. It has also been shown that being on a Mediterranean diet will decrease your risk of events that are caused by blocked arteries. So heart attacks. Clearly been shown that you decrease your risk of heart attacks. You decrease your risk of cardiac death with a Mediterranean diet significantly. And as you age, if you look at people above age 60, the survival of the patient, if you randomize them to either a Mediterranean diet or a Western diet, the people on the Mediterranean diet clearly live longer and have fewer heart attacks.
And it's tastier. Can we get a question from the online audience, please? More sleep.
We're back to sleep.
Maybe you should have a conference just on sleep.
Yeah.
It's not a bad idea. Nightmares. What about nightmares, interruption of sleep, and how do you prevent them?
Yeah, so the questions around nightmares. So our definition of, just to clarify, our definition of nightmares versus just bad dreams is when you actually wake up from the bad dream and you have these symptoms of feeling basically anxious, worked up, etc. Most common thing comes to mind is PTSD. We see nightmares with those, but not most nightmares probably not just caused by that. It really depends. Some of my patients describe nightmares of suffocating, falling off a cliff, being claustrophobic. That sometimes could be a sign of apnea, that you're not getting enough air, and that's what sometimes wakes up people. We have probably most of us have experienced some form of nightmare of missing a plane or showing up to somewhere naked or losing our teeth or not being, as naked as not prepared, like, to do something. Those tend to be anxious dreams. They come up a lot with insomnia patients. There is the best treatment for nightmares, and this is well documented with PTSD, something called image rehearsal therapy, which is a cognitive form of cognitive behavioral therapy, mostly cognitive therapy really. in terms of the simplest way to explain it is we think about, especially if you have recurrent nightmares of people having associated with previous trauma, whether it was assault or being in a war zone, et cetera, that we see with vets, is reimagining basically the event of the dream and imagining alternative endings. And we've had good success with that therapy, and there's good therapists. Actually, with the clinic I'm working with, Helix Health, we do have great therapists who focus just specifically on that type of therapy. There's also medication. It's been kind of mixed, the results with medications for nightmares.
Are there any more questions from the floor? Oh, there's.
Yeah, I read the books on the Blue Zone, and they talk about like Okinawa, about it diminishing in the Blue Zone of the area because of access to all the foods that are quote unquote not Mediterranean or not even correct. You know, they're all the advertising we have to convince us of eating something sweet and salty.
So is that a question?
Yeah, that is a question. Is there resistance to this?
So, okay, the question
What's
is,
going on around us? We
Yeah.
try and resist, but is it easy?
it isn't easy. No, corporate America is very difficult to, they're bigger than we are. So the question, or the statement, and I guess the question related to this is, the statement is that the blue zones are shrinking, and if you go to Okinawa now, there are fewer centenarians. Well, some of them died, but there are no new ones. Okay, and then and actually, the documentary showed Dan goes back to Okinawa 20 years later, and there's Pizza Hut, and there's McDonald's, and and everybody's driving, and nobody's walking anymore. So what's happening is, as we evolve, our bodies haven't evolved, but the culture changes. So there's this big move, and to establish new blue zones. And he started out in Minnesota. He's from Minnesota, and I think they're going to start one in Monterey. And it basically is a partnership between the city and the citizens on how to implement, change the reverse culture. The example they used was in Singapore. Of course, in Singapore, where you go to jail for chewing gum, it's very easy to say, you got to exercise, you got to do this, because we don't want to pay for your hospital bills when you're 80. So they've done that, and they've actually torn up roads, made walking paths accessible. And there's actually, I live in Los Altos, and there's Greentown, Los Altos, and they're trying to do that. They're trying to convert less parking lots, more community centers in the parking lots, like little parklets, and then we're trying to expand bike pathways. So there's a movement, but it is true. It's you're just inundated with commerce, and the zones are shrinking, but there's a pushback from the people. And I think we have time for one more question. Oh, you need a microphone.
Do you think food additives that we have in this country and have an effect? Because I think the blue zone areas probably have much fewer food additives. Zero, yeah. And my other question is a sleep question. Is magnesium helpful for sleep?
Okay, so the question is food additives and impact on health, and the other question is for Dr. Masri again about the sleep. Okay, magnesium and sleep. Go ahead.
Food additives, again, we weren't involved to deal with all of these additives, and they're put in to preserve the food. And they do that, but at what cost? And that is currently being evaluated. It's much healthier to eat your food that's fresh. Much healthier, much better for you. Okay?
Yeah, quick answer on magnesium because we have to wrap up. The answer is no. You can't use magnesium to treat insomnia, but if you have a magnesium deficiency, by all means, you should take it. There's some data on mild restless legs that magnesium can be helpful. So make sure you're not deficient. And if you take a supplement and it helps you sleep, there's also a placebo effect, then maybe you can do that.
Okay, but our time is up, so I'm getting like the.
Thank you, doctors. Thank you so much.